So now we are going to discuss certain questions on pleura and lung. Just read that question. Name the structure which produces impression just above the hilum of right lung. What is the answer? It is azygos vein. Correct. So look at that figure. You are seeing the right lung and left lung. Both the figures are there. Just concentrate on right lung, which is the structure which produces the impression just above the hilum of right lung. It is the arch of azygos vein. Look at that. After that, this arch of azygos vein is finally draining into superior vena cava. What about left side? Left lung, it is aortic arch. Next question. The bronchopulmonary segment is that part of lung which is aerated by. What is the answer? It is the tertiary bronchus, and that is the definition of bronchopulmonary segment. It is that part of lung which is aerated by tertiary bronchus. Look at that. That is a diagrammatic representation. It is a function. A bronchopulmonary segment means it is the functional unit of lung, and you find one segment there. Each segment is that part which is aerated by a tertiary bronchus or segmental bronchus. Fine. And there are 10 bronchopulmonary segments on each side. On right lung you find 10, left 10. Name the parts of parietal pleura. Very easy. What is it? The parietal pleura, based upon the position, is divided into cervical pleura, costal pleura, diaphragmatic pleura and mediastinal pleura. So remember, this cervical pleura which covers the apex, very close to the apex of the lung. This costal pleura, very close to the intercostal spaces, close to the mediastinum, we have the mediastinal pleura. Lower part you find the diaphragmatic pleura. So this costal pleura becomes continuous with the mediastinal pleura anteriorly and posteriorly by a line. That line anteriorly, where the costal pleura becomes continuous with the mediastinal pleura, is what is termed as a costo-mediastinal line of reflection. And that line where the costal pleura becomes continuous with the mediastinal pleura posteriorly, that is what is termed as a costo-vertebral line of reflection. This costal pleura becomes continuous with the diaphragmatic pleura by a line, and that is what is termed as a costo-diaphragmatic line of reflection. Fine. So you are seeing the same thing. Based upon the position, can divide the parietal pleura to cervical, costal, diaphragmatic and mediastinal. Now answer this question. Name the two recesses related to the pleura. It's one of the very common question or very common short note you get for your exam. Recesses of pleura. They are the two recesses. Just identify them. One is the costo-diaphragmatic recess and the other one is the costo-mediastinal recess. The development of visceral pleura is from where? It is from splanchno-pleuric mesoderm. That you should remember. This pleural cavity. The pleural cavity will be developing from the intraembryonic coelom. Do you remember the intraembryonic coelom? This intraembryonic coelom will be divided or will split the lateral plate mesoderm into somatopleuric and splanchno-pleuric intraembryonic mesoderm. So this somatopleuric intraembryonic mesoderm will give rise to, or from it develops the parietal pleura. The pleural cavity will develop from this intraembryonic coelom, and this visceral pleura will be developing from splanchno-pleuric mesoderm. It is into that coelom you find the lung bud is developing. So imagine a balloon into which your hand is invaginating. Close to your hand you find the visceral pleura. Away from your hand, just like away, you find the parietal pleura, and in between that you find the cavity, and that is the pleural cavity. Where these two becomes continuous, very close to your wrist, that will be the region of your pulmonary ligament. And so that is the reason why the visceral pleura, which is developing from splanchno-pleuric mesoderm, will have the same nerve supply and innervation as that of the lung. The parietal pleura, since it is developing from somatopleuric, will have the same nerve supply and innervation as that of the intercostal space or the thoracic wall. Next question. Which of the following is the uppermost structure in the hilum of right lung? What is it? It is the bronchus. What are the structures passing through the hilum of right lung in order from above downwards? Can you name it? First is eparterial bronchus, then A, artery, pulmonary artery, then hyparterial bronchus, then vein. So that is the order in right lung. Left lung, what is the order? First you get A, artery, pulmonary artery, then you get bronchus, then you get vein. You are seeing the arrangement of structures on right side and left side. Look at the right side. First bronchus, then what else? Just say the order. First you find the bronchus, then you find the artery, then again the hyparterial bronchus, then the vein. On right side, first you find the artery, then you find the bronchus, then you find the vein. So now read the next question. The bronchopulmonary segment of right upper lobe. Very easy question. Answer it. It is A, apical, anterior and posterior. So look at that. You find 10 segments on either side, right lobe and left lobe, right lung and left lung. And upper lobe you are seeing 3. That is apical on right side, apical, anterior and posterior. Then the middle you have got medial and lateral. Lower lobe you get 5 segments on right. That is superior. And androbasal, posterobasal, medial basal and lateral basal on right side. Name the structures related posteriorly to the apex of lung. This could be asked in another way. What is the other way? Name the structures related to the neck of first rib. They are the same. Can you name the structures? One is sympathetic trunk, then highest intercostal vein, then superior intercostal artery and T1 ventral ramus. So why this becomes important is, suppose you get a tumor in the apex of lung. If it is compressing the structures behind, these are the structures that could be compressed, leading to different effects. So sympathetic trunk, highest intercostal vein, superior intercostal artery and ventral rami of T1. Next one, very easy one. Suprapleural membrane is derived from endothoracic fascia and dash muscle. It is scalenus minimus. Scalenus minimus muscle. Name 3 structures affected and the effect produced by it in malignancy affecting the apex of lung. So any 3 structures you can say. First, anteriorly, if the subclavian artery is compressed, you get decreased pulsation felt in the upper limb. If subclavian vein and the brachiocephalic vein is compressed, you get edema or venous engorgement or edema present in your face and upper limb. Posteriorly, if the sympathetic trunk is compressed, you get Horner syndrome. If T1 segment is affected, you get wasting of the muscles of your hand, paresthesia or numbness along the distribution of T1, like that. So depending upon the structures that could compress, these are the effects that we get. Next question. Name the structures pierced in order while doing a pleural tap. Very easy. Starting from skin, then fascia. Inner to that, you're doing a pleural tap in the mid-axillary line. So commonly, or you will see the next layer as a serratus anterior muscle. Remember serratus anterior we took on upper limb? So then serratus anterior will be pierced. Then it reaches the intercostal space where the 3 intercostal muscles, external, internal and innermost intercostal muscles will be pierced. Then still inner to that you are seeing a fascia. That is what is termed as the endothoracic fascia. Then you pierce the endothoracic fascia, then the parietal pleura, and then your needle will reach the pleural cavity for a pleural tap. Next question. The inferior margin of pleura corresponds to dash rib in mid-axillary line. What is the answer? Answer is 10th. So when you are considering or when you are thinking about the inferior border of pleura, you remember it has 3 numbers. It is 8, 10, 12. What is this 8, 10, 12? This inferior border of pleura is corresponding to 8th rib in mid-clavicular line, 10th rib in mid-axillary line and 12th rib in scapular line. That is the inferior margin of pleura. When you are thinking about the inferior margin of lung, you just minus 2. What will be it? The inferior margin of pleura was 8, 10, 12. So the inferior margin of lung will be 6, 8, 10. 6th rib in what? In mid-clavicular line, 8th rib in mid-axillary line, and 10th rib in scapular line. So you are seeing it. The lower border of pleura, 8th rib in mid-clavicular, 10th in mid-axillary, and 12th in scapular line. So that's a very easy way of remembering the inferior margin. In a bronchopulmonary segment, dash is intersegmental. A very, very easy question. Answer it. It is the pulmonary vein. It's a tributary of pulmonary vein. Look at that figure. You find that is a bronchopulmonary segment, and you find it is pyramidal in shape with the apex projecting towards the hilum, that region. And when you are concentrating on the pulmonary vein, look at that, it is lying in between, it is intersegmental. All other things, you find the tertiary bronchus, the pulmonary artery, they are all confined to a segment, but pulmonary vein is intersegmental. Last question. Which is the most dependent part of the pleural sac in standing position? And that is the costodiaphragmatic recess. I think we have already shown you a figure on costodiaphragmatic recess. That is the most dependent position, and some applied importance of that you should know. That is the first region where you get the pleural effusion. The pleural fluid will be accumulating in effusion. Fine. So these are some of the points that you should be aware in lungs and pleura. So I think most of the things you are knowing. The other things, if you are not aware of it, just go through any textbook, read it again and again, and make those concepts clear. Fine? Okay, thank you.